An unusual mix. A clinical vignette from Scripps Green Hospital in La Jolla, California. Over 95% of malignant neoplasms of the pancreas arise from exocrine elements. Ductal adenocarcinoma and its subtypes, which is what we usually think of when we think of pancreatic cancer, account for about 85 to 90% of exocrine pancreatic neoplasms. Acinar cell carcinoma accounts for only about 1% of these tumors. And then there's the pancreatic neuroendocrine tumors, which make up about 1 to 2% of all pancreatic tumors. So it is even more rare that patients can present with a mixed acinar neuroendocrine tumor of the pancreas, with only a handful of cases reported to date. Given the paucity of cases, these admixed tumors present a therapeutic challenge, as there is no standardized treatment regimen. Our patient is a 43-year-old otherwise healthy male who presented to urgent care with only 1 week of generalized malaise, right upper quadrant pain radiating to the back, nausea, acid reflux, dark urine, and clay-colored stools. Given his initial concern for COVID-19 infection, he isolated himself at home and took Tylenol as needed for pain and Tums for acid reflux. On presentation, his exam was notable for diffuse tenderness to palpation, particularly in the right upper quadrant. His vital signs were stable, and he had no jaundice or scleral icterus. Labs on admission were notable for hyperbilirubinemia to 5.9 with a direct component of 4.5, alkaline phosphatase of 163, ALT elevation to 916, AST to 456, and lipase of 603. He was admitted to the hospital and initially underwent MRI with MRCP that showed dilated common bile and pancreatic ducts, with abrupt narrowing at the head of the pancreas, but no discrete lesion was identified. He then underwent endoscopic ultrasound with ERCP that revealed strictures of both the common bile and pancreatic ducts, for which a common bile duct stent was placed. His endoscopic ultrasound did note a poorly defined hypoechoic mass in the pancreatic head as well as perihilar lymphadenopathy. Fine needle aspiration of these structures revealed the following specimens as seen in figures 1 through 4. Figure 1 shows H&E staining of tumor cells. Figure 2 reveals specimen stained with synaptophysin. Figure 3 reveals positive staining with trypsin, and Figure 4 positive staining with BCL10. Based on these findings, the patient was diagnosed with a high-grade mixed acinar-neuroendocrine carcinoma of the pancreas. Staging PET-CT showed hypermetabolic activity in the pancreatic mass and adjacent lymph nodes, with an additional concern for lesions in the liver, which were unfortunately confirmed on CT abdomen, as seen in Figure 5. He was started on chemotherapy with FOLFIRINOX, and given his young age and family history of pancreatic cancer in his maternal grandmother, he underwent genetic testing, which revealed negative results on multi-gene panel testing for hereditary pancreatic cancer. So as you can see, mixed acinar-neuroendocrine carcinoma of the pancreas is a very rare subtype of pancreatic cancer. The first case was reported in 1982, and there have only been a handful of cases reported since. These tumors are defined as those that have both acinar and endocrine components, with each constituting at least 25% of the neoplasm. Tumor cells show immunohistochemical positivity for pancreatic enzymes, including trypsin and chymotrypsin, which account for the acinar component of the tumor, as well as endocrine markers, including chromogranin and synaptophysin. Given the paucity of cases, there is no definitive treatment regimen for these admixed tumors, though case reports do suggest targeting treatment to the acinar cell component of the tumor. Prognosis is similar to that of acinar cell carcinoma, with a median survival of 38 months in those with localized disease and only 14 months in those with metastatic disease, as is the case in our patient. In conclusion, it is important to understand both the presenting and diagnostic features of mixed acinar neuroendocrine carcinoma of the pancreas, as it will help inform both diagnosis and treatment of this very rare disease moving forward. Thank you very much.